Moving on to the urinary system part of Module H. Our urinary system is the filtering system of our body. It's responsible for ridding our body of waste products from our blood. It is made up of our kidneys, ureters, bladder, and urethra. Our kidneys are bean-shaped paired organs. They're located at the back of the abdominal cavity, slightly above the waist. Each kidney is about 4 or 5 inches long and about an inch thick. Our kidneys filter waste from the blood and produce urine. And in doing all of this, they also maintain water balance and blood pressure and regulate the amount of electrolytes in our body. So our kidneys, super important, right? Our ureters are narrow tubes that connect the kidneys to the urinary bladder. They're about 1 foot long in everybody. Our urinary bladder is a muscular sac that stores urine until it passes from the body. The urethra is a tube that's located between the urinary bladder to the outside of the body. In males, the urethra is about 7 or 8 inches long, and in females, it's about 1.5 inches long. So, and we'll talk more about that because when we talk about common conditions or diseases or issues with the urinary system, we talked about urinary tract infections, and it's the length of the urethra in the male anatomy versus the female anatomy that makes females more prone to urinary tract infections. All right. So the urination is the passing of urine from the bladder through the urethra to the outside of the body. You may also hear it called micturition or voiding. Same thing. Our urine is made up of water and waste products that have been filtered from the blood by the kidneys. Many factors can change the color of urine, such as medications, certain foods and dyes, vitamins, supplements. For example, if you've ever taken B vitamins, they make the urine the bright yellow. Beets, if you eat a lot of beets, can cause like kind of pink or red tinge to the urine as well. But normal findings, we see that urine is light yellow to amber in color. It's clear or transparent when freshly voided, and it's going to have a faint odor. We also expect at minimum people to void between 1,000 and 1,500 mils or cc's per day. As we age, some of the changes that we see is a decrease in the kidney size and in the kidney's ability to filter blood. Our bladder, loses muscle tone, elasticity, and has a decreased capacity. We have difficulty or incomplete emptying of the urinary bladder sometimes as we age. Males tend to have enlargement of the prostate. When males have the enlargement of the prostate, which we'll talk about BPH in a minute, but oftentimes these individuals are having to wake up several times at night to urinate. As we age, our sense of thirst, we're less thirsty, so we take in less, but that also can result in less urine output and dehydration. So that's something that we really need to be aware of as nurse aides. Now, some variations from the normal that we need to make sure we are reporting is if we notice changes in the urine, and that could be color, cloudiness, odor, the amount and frequency, presence of sugar, acetone, blood, or sediment. Now, those items that I just listed, you would learn by doing a dipstick to test urine, like a urinalysis. But like the color, the cloudiness, the odor, the amount and frequency, we can observe those and measure those. And if those are changing, it can be a sign of an infection. Other changes in the urinary system to watch for: weight loss or gain, swelling in the arms and legs, dysuria, which is pain or burning during urination, swelling in the bladder or abdomen, pain in the back above the kidneys, incontinence, and fever. I mentioned the UTI. It says recall the difference in the female and male urethras because, again, of that distance that bacteria has to travel to actually get to the bladder is so much shorter in the females. That's why it's more common. So it's not unheard of by any means for a male to get a urinary tract infection. It's just less likely. A urinary tract infection is an infection of the urethra, bladder, ureter, or kidney. And it's typically caused by E. coli, which is a bacteria found in our digestive system, which is why infection prevention practices are really important, that wiping from front to back, because we don't want to actually accidentally introduce E. coli bacteria into the urethra. Some signs and symptoms of a urinary tract infection include frequency, having to go a lot, urgency, having to go right away, voiding in small amounts, pain, and burning. Like I mentioned, as nurse aides, we want to make sure we're doing the infection prevention, careful and good peri-care, keeping adults, these patients clean and dry, but encourage fluids. So even if someone's incontinent, for example, we don't want to ever discourage fluids, to make it easier on ourselves. For example, if someone's going to be incontinent throughout the day, it's not a reason to not encourage adequate fluid intake. We want to make sure we answer call bells promptly, and offer fluids, and bathroom every 2 hours at least. You may have heard of kidney stones, also called renal calculi. These form when urine crystallizes in the kidneys for a variety of reasons. They can block the kidneys and ureters, causing really excruciating pain. These patients will complain of this excruciating pain in their abdomen, flank, or back. Urination is painful and more frequent. There's going to be blood in the urine. They may have, because of the pain, nausea and vomiting, chills, and fever. So a lot of times as nurse aides, we may have to help with straining of the urine. That's a process of pouring the urine into a fine filter strainer to catch particles that are going to be sent to the lab. So I mentioned the enlarged prostate. So you may have heard of BPH, or benign prostatic hypertrophy. This is a disorder common in men over the age of 60. It's when the prostate gland enlarges and causes pressure on the urethra. So you can see in this image, the urethra goes straight down the middle of that drawing, and the prostate surrounds it. It's kind of actually like a donut, and the urethra goes through the center. So when the prostate enlarges, it compresses that urethra, making it difficult to start a stream and to empty the bladder completely. Some signs that someone may have BPH: frequent urination, dribbling of urine, and difficulty beginning the stream. They may also have urinary retention, like I mentioned, when urine remains in the bladder. And because of this, that can cause urinary tract infections. And if it gets bad enough, urine that was in the bladder can actually back up even further into the ureters and kidney and cause damage to those structures. So when it comes to BPH, our role is to report signs of infection, and provide adequate and thorough peri-care and assist as needed. Chronic kidney disease, or CKD, this is lasting damage of kidneys that worsens gradually. And there are 5 stages, with the later stages resulting in the need for dialysis. Chronic kidney disease can be prevented from advancing into further stages by controlling certain things like diabetes, maintaining a healthy blood pressure, exercising regularly, and maintaining a healthy weight. You all are familiar now with urinary incontinence, okay? But there are a few different types of urinary incontinence which you may not have known. As you know, it's the inability to control the bladder, leading to the involuntary loss of urine. Something to keep in mind: this is not a normal part of aging. It may become more likely to happen with aging, but it's not a normal part of it. This can occur in residents who are dependent, confined to bed, paralyzed, elderly, or have diseases of the nervous or circulatory system, and that's important to remember. So incontinence can also be caused by nervous or circulatory system diseases. Now, those different types of incontinence that I mentioned: stress incontinence. This is loss of urine with sneezing or coughing. Urge incontinence is involuntary loss of urine from a sudden urge to void. Functional incontinence is the loss of urine caused by cognitive, physical, or environmental reasons. And overflow incontinence is the loss of urine to bladder overflow or distension. Our role when we know someone has urinary incontinence is to answer that call bell as quickly as possible, because when they gotta go, they've gotta go. Every single time we go into that room, ask the resident, encourage them to void. Keep our residents clean and dry. Both stool and urine can be extremely irritating to the skin and cause breakdown, which makes it much more likely that our residents might suffer from pressure injuries. We want to change wet clothes and linen immediately, and like I mentioned before, continue to encourage fluids. Be respectful and provide reassurance. Try to always refer to adult briefs as briefs, not diapers, and that's just to respect and dignity, to provide respect and dignity. Residents with incontinence must be kept clean and dry, and follow that infection prevention by wiping from front to back. Always provide privacy. Do not rush or interrupt your resident. And encourage residents to drink those, I repeated that already, to drink fluids. The ideal position for urination, this is important to remember. For men, it's standing. So even if you have grandpa who he may be weak and can't stand for very long, but if you can get him up to void, to urinate, that's still going to be the first choice, the best choice for him. For a woman, it's going to be sitting up in the seated position to void. And that concludes the urinary system.